Thank you. And my last question would be to Dr. Eckhart. So from your very impressive expertise in bringing orthodontist like insights to aesthetic medicine and looking at maybe thousands and thousands of different smiles and kind of evaluating the aesthetic outcome, what would you summarize the absolute do not do, like the absolute no-no in relation to addressing the aesthetics of the lips and thinking of it dynamically in relation to the smile?
Probably the key thing would be to not do what the patient specifically comes in and asks for. When I see patients and I examine patients, I try and get them to tell me what it is that
Closer to you.
I try and get them to tell me what it is that they don't like, not what they want me to do. And so I want to have a clear picture of what it is that they're unhappy with. And fair enough if they want to give me an idea of what it is that they want to become, but it's key that we don't follow blindly what they ask for, and that we assess things carefully and then tell them the best way to achieve those goals. And in this country, certainly, we have to adhere to informed consent. So we need to go through all the different options of how we might achieve that and give them the pros and cons of everything, and never be bullied into doing something that you're not happy with doing. So that would be my key thing, is go with what I think is the best way to treat them, not what the patient specifically asks for.
I like this, you highlight the importance of the informed decision, and it's a partnership with the patient. There is a huge value for education and sharing like the patient's expectations. Tomorrow, actually, I will be asking Fahad to allow Mr. Nasser to give us just 10 or 15 minutes of his insight how to manage unrealistic expectation. I mean, he has been in the aesthetic field for 35 years and he has amazing insights to share with us. Hema?
I think that was so beautifully put, Charlotte. The important thing is that we're embarking on a journey with our patients. It's absolutely fine for a patient to suggest what destination they want to reach. But given that they're consulting us, it's our responsibility to advise them on the journey that is best taken to reach that destination.
Okay, so I will ask now the panelists to go back, and then we will move to the last activity.